Normal heart rate. Now take a look at this healthy human heart beating at a level of 80 beats per minute. A normal heart rate is defined by 60 to 100 heartbeats per minute in resting adults. Bradycardia is, per definition, below 60, and tachycardia above 100 beats per minute. Myocardial infarction. Due to a lack of oxygen supply through a blockage in the coronary vessels, cells can be damaged or die if not treated quickly. A myocardial infarction, also known as a heart attack, is the irreversible death of heart muscle tissue. The key to recovering is receiving treatment as quickly as possible and restoring the blood flow. Arterial hypertension. Arterial hypertension is commonly known as high blood pressure. High blood pressure can result in coronary heart diseases and should be treated and monitored properly. If left untreated, AH can lead to arteriosclerosis, stroke, kidney damage, enlarged heart, and even heart attacks. Atrial fibrillation. Unlike ventricular fibrillation, atrial fibrillation is not directly life-threatening. Approximately 70% of AF attacks are not even noticed by the patient. But atrial fibrillation includes rapid or irregular beating and can lead to symptoms such as fatigue, palpitations, or insomnia. If not treated, AF can increase risk of heart failure, stroke, and dementia. Heart failure. In chronic heart failure, also called cardiac insufficiency, the heart is no longer able to supply the body with sufficient blood and oxygen. Typical symptoms include severe shortness of breath, especially on exertion, swollen legs, and fatigue. The causes of heart failure are loss of function of the heart muscle, often the result of coronary artery disease or myocardial infarction, or a change in hemodynamics, meaning blood flow in the heart, for example, in valvular disease or arrhythmia. Heart failure with preserved ejection fraction, HFpEF, means that the ventricle has the same ejection fraction as that of a healthy heart, greater than 50%. But the heart is usually filled with significantly less blood due to a thickening of the heart muscle and a decrease in the heart's elasticity. This means that less blood enters the ventricle during the filling phase, and consequently, less oxygen-rich blood enters the circulatory system and more congestion occurs in front of the heart. Normal heart rate. Now, heart failure. In chronic heart failure with preserved ejection fraction, heart failure with moderately reduced pump function, HFmrEF, describes a condition between HFpEF and HFrEF. Heart failure with reduced ejection fraction, HFrEF, is the reduced ejection volume of blood due to a weakened heart muscle. While a healthy heart can eject between 60 to 70% of its volume, the value in HFrEF is less than 40%. As a result, less oxygen-rich blood enters the circulatory system during the ejection phase. When this forward failure occurs, there is also congestion in front of the heart at the same time. For example, in the lungs and in the body, especially the legs.